Hello and welcome to my course, Toilet Anxiety, How to Understand and How to Eradicate. My name is Dr. Baruch Kushnir. In November 1987, a couple arrived at my clinic and told me about their son Ari, an 11-year-old boy who had been suffering from prolonged constipation for years. Sometimes a month passed with no pooping at all. He was incapable of having bowel movements on the toilet. He would change about 20 pairs of underpants each day. He did not go to school and could not attend any social situation. The stench surrounding him turned his life into a web of terrible rejection, shame, and isolation. All the doctors ruled out a physiological problem, and no medical or psychological intervention helped. At that time, I was right at the beginning of my career as a bedwetting expert. I had almost no understanding of pooping problems. However, the severity of the problem and the family's distress triggered me with a great intent to assist. I decided to delve into the field and explore the professional literature with the hope of coming up with some creative ideas for treatment. After a month, I called the parents and offered them an intervention program. I presented them with the theoretical model I had created and instructed them on how to operate at home. After 3 weeks of intensive work and adherence to the program was resolved. Since then, I have been formulating therapeutic strategies to help children and their parents get out of the cycle of difficulty and frustration associated with pooping problems. Over the years, I've identified 3 main diagnostic groups in this area. Group 1. Soiling. These are children who can use the toilet but still release quantities of feces in their underpants and go about their businesses as if nothing had happened. Group 2. Soiling with severe and prolonged constipation and withholding. These are children who refrain from bowel movements for days or even weeks, release small amounts of feces in their pants, and hold it there for hours. Group 3. Toilet anxiety. The children in this group are not at all able to poop on the toilet bowl. Some cannot even sit on it. Some of them can sit on it for long periods of time, but eventually poop only in their pants. Toilet anxiety is a common phenomenon. Its treatment can be quite simple. What is required here is 1. A basic understanding of the problem, and 2. The implementation of simple guidelines both regarding deeds, what to do and what not to do, and regarding speech, what to say and what not to say. In this course, I'm going to focus on teaching you step by step how toilet anxiety develops, how to identify it, how to control it, how to eradicate it, and finally, how to navigate your child to normal use of the toilet. See you soon!